This morning exercises and stretches. Okay? First one is a squat. Relax your knees, bring your arms out in front of you, arch your back, push your rear end behind you just a little bit. You want to put your feet about shoulders width apart, and you're going to just squat down. Go all the way down, go all the way down, go down, down. And you should be able to get to where your heels are flat, toes are flat, feet straight out in front of you. And put your cheeks between your knees. You hold that position until you're comfortable there. You should feel no tension in your neck and down your rear end. Then from that position, you're going to go to a kneeling position. Put your feet flat on the floor. You should be able to sit your bottom on your heels. Again, hands out in front of you. Arch your back. And what you're going to do is just bend over, touch the floor, keeping your back arched, keep your rear end on your heels, and you're going to lay down, lay down, lay down until you put your head all the way on the floor. Hold that position until you're completely comfortable. No stretching discomfort. After that, you're going to go into what I call a flying Superman, but it's in opposite sides. You're going to lift one arm, right arm, left leg. You're going to look toward your hand and reach up with both the leg and the arm opposite side. Then you're going to repeat it. Opposite side, left, right leg. Look toward the hand. Nice gentle stretch, arch in the back. You should feel like you're a bow arching over your rib cage and your stomach. Then what you're going to do is a plank or a push-up. You want to hold this, your time frame, don't stress it. You hold it where you're comfortable. There shouldn't be any swagging or arching. It's a level plank. If you feel strong enough to do push-ups, you go down, part of the way, hold, down, hold, and up. You should be able to maintain that plank position. If you can't, don't go any longer, don't strain. You can do it on your knees like this as well as the push-up. After the push-up, you've worked the front, then you're going to work the back. Lay on your back. And this is like the reverse Superman. You're going to bring arm and leg up, and the critical component is not the arm and the leg coming up. It's the pressure on the down leg and the down arm. Your head turns to the hand just like it did before. You look to the hand, you push down with the opposite arm, opposite leg, pushing down, and your back should have that same arch, that same roll that you had when you were on your stomach doing it. You should feel your back lift up off the floor. So you're going to come across, hold that position, tighten your glutes real good so that you form a nice stable arch across your lower back and into the shoulder. You should feel pressure on the shoulder down and on the opposite glute down as you tighten those together. Looking up toward the opposing hand. You do 5 of them, you do 10 of them, you find a comfortable position, you increase it 1 repetition every 3 days. After you do extension, you're going to do flexion again. And with the flexion here, we're going to do a sit-up or a crunch, depending on where you're at. Cross your arms across your chest. And what you're going to do is you're going to take a deep breath in. Deep breath in. As you breathe out, you're going to tighten your glutes both sides. Don't use your legs to elevate and roll your hips. Tighten your glutes both sides. Squeeze, 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 and then pretend you're stopping urine flow. Stop everything, blow out, blow out, blow out. Hips come up first. Then you bring your chin up, continuing to blow out, and then you come up. So it's a 3-step process. You breathe in, let it out, tighten your buttocks, tighten the glutes, tighten, 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 stop the urine flow. 1 with the hips, 2 with the head, 3 with the shoulders. Okay, if you can only come up to 1, 2, 3, and this is it, that's what you do. You work up to where you can do 20 of these, and as you get to where you can do 20 of just a crunch, you should then be able to get to where you can do 1 sit-up. So then you would go out, blow out, blow out, blow out, tighten, tighten, tighten. 1, 2, 3. You should be able to come up without elevating your legs. Don't anchor your feet down. If you cannot sit up without your feet coming up, you should only be doing crunches. It's important to have about a 45-degree angle at the hip to the waist and 45 at the knee to the upper thigh. Don't have it too close and don't have it too far out. So that was flexion. Then we want to do extension again. You can either turn on your stomach and do the laying on the stomach Superman, or go back to the back. And you're going to elevate opposite side, look up to the hand, push down, same as we had done before. After you've done the extension, you then want to do an oblique. And the way you do the oblique is you bring the knees up, flatten the back onto the floor. Once the back is flattened, then you lay your legs over. Place your hands behind your head like a basket for your head. Do not pull on your head and neck. You force the opposite shoulder back as flat as you can get it, keeping the knees bent and your waist flexed. You're going to deep breath in and out. You tighten the buttocks, bring the hips up first, then you lift instead of your head, since your head is already hanging on your basket. Then you're going to lift your sternum to the hip. Imagine lifting your sternum to this hip. So it's breathe in, breathe out, 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 tighten, tighten, and then up with the chest to the hip. Chest to the hip. That line approximates. Okay? Then you're going to do the extension again. Opposite side, and then you're going to go again up, over, forcing that shoulder back, relaxing the head and neck. Breathe in, breathe out, tighten the waist. Then the head will come up slightly. Then lift the sternum to the hip and up. Keeping this shoulder down. Don't let this shoulder rotate. Keep it back so that you're rolling up on the opposite shoulder. You're coming up on that opposite shoulder with this arm forcing it back. And your fingers should be working just like a basket holding your head. Not pulling on the head forward. Head should be like this. Arms back. And you lift from here to here. You've done flexion, then you're going to do extension again. Come up, or you can do a chair dip or a floor dip to where you're here. And when you do these, you imagine squeezing your arms together behind you. You squeeze behind your back, squeeze behind the back. Instead of just doing this, it's a squeeze backwards. Squeeze backwards. And that creates an arch system by which you always activate extension, waking you up, versus flexion. And that stabilizes your morning. You increase it by 1 every 3 days and go from there.